This is Dr. Matthews again for Chapter 9, Safety Issues. And this is probably the most important chapter that we can talk about. Biosafety is laboratory safety involving biological agents. They may be bacteria, viruses, fungi, any microorganisms, toxins, and anything that can adversely affect human health, all the way from a mild allergic reaction to serious medical conditions and death. Biosafety, we have very strict guidelines on how to handle laboratory use. And OSHA, Occupational Safety and Health Administration, has got a set of guidelines, and they will send inspectors to your hospitals, to your labs, and they will check them out, and if you don't have it right, they're going to be really mad at you. There was a hospital who they did not have their safety data sheets in order. They didn't know where they were, and OSHA made them pay $10,000 a day until they got it fixed up. So everybody worked overtime that week. They got it done in about 3 days. It was a huge hospital. Center for Disease Control, we're all familiar with that. World Health Organization, and the Department of Health and Human Services these are all organisms that have rules about safety. Biosafety levels. These are very important when working with microbes. It's a difference in what you're working with. Now, at Flint Tech, we have been certified only as a Biosafety Level 1 lab. That means that there are organisms that we certainly can't deal with. We can only deal with things that don't generally cause disease in healthy humans, which suits me just fine. I think the one in Griffin, and I don't know about Henry, is a Biosafety Level 2 lab, and they're designed to work with agents that may have a little bit higher risk, and they have better containment devices and stricter guidelines than Biosafety Level 1s. Like they have to have a special cabinet for their microbes and to work with their microbes. Biosafety Level 1 organisms. These are just some of the things. Lactobacillus. You make yogurt with it. E. coli generally is not a pathogen. If it is, it's a variant of E. coli. It's just normal colon bacteria. Canine hepatitis virus is going to be a real problem if you're working around dogs, but there is a vaccine for the dogs, but it's not going to hurt a human. I really disagree with this one. Bovine leukemia virus. I'm not getting near that stuff. It causes leukemia in a cow. I don't want to get near it. And then there's no proof that it causes any problems in humans. I'm concerned about it. Guinea pig herpes virus. They're all labeled as Biosafety Level 1. Things for Biosafety Level 2, things like some of the streps and Staph aureus, Streptococcus pyogenes, Salmonella, Toxoplasmosis, coronaviruses, but I'm afraid that we've got some that have had to be moved up to Biosafety Level 4, like as in COVID is Biosafety Level 4 for sure and for certain. We're not going to have this on Griffin campus voluntarily. Okay, Biosafety Level 3. This is going to be for big research facilities that we're working with these deadly agents. Increased laboratory safety, much more training, and the door's locked. Not everybody can come in. Only people who are supposed to have access. Everybody's going to be wearing masks and gloves and goggles and lab coats all the time. These are going to be things like anthrax, brucellosis. Let's see, I saw an interesting. Yersinia pestis, that's a nice one. That causes bubonic plague. Yellow fever, any of the arboviruses, these ones you don't want to get. Now, Biosafety Level 4 for exotic agents like COVID-19, high risk of aerosol transmission like COVID-19 that are life-threatening. They all sound familiar for COVID, don't they? Staff in these laboratories must have specific training to handle these specific things, and if they're sloppy, they can release their viruses or bacteria out on the world and cause major pandemics. I didn't say anybody did, I said that could happen. And facilities handle these agents. These agents are going to be in separate buildings or in controlled areas, completely isolated from everything else, so that nobody gets sick. Smallpox is an example. Ebola, hantavirus, all these hemorrhagic fevers, we don't know what they are. And now COVID-19. Chemicals in the laboratory. Now I took this is a slightly out of date thing, and you'll still get a lot of these safety data sheets that still have MSDS, but that is out of date. Now you're supposed to just have safety data sheets, and it makes some kind of big difference to somebody somewhere, but most of the companies are sending still the ones with the M on them, but they're called safety data sheets for each chemical in each laboratory. And I have mine physically in the room, and plus they have been put online in a place that someone knows exactly how to get to. So if there was a lab accident, that they could know what the chemicals were. And this, again, so I changed that to safety data sheet, but they have this material here. And most of the ones you see are going to have it. But it tells you what the name of the thing is. And these are so small I can't read them. But it tells you the chemical name, solubility, emergency things, health hazards, like whatever this is, it's too small for me to see, may result in corneal injury. We don't want that. Anyway, it goes on and tells you what the diseases they can cause. Now, before you handle these things, you should probably read these safety data sheets and read the labels, and then you'll know what you're getting into. Okay, radiation. If you have radiation in the lab, that requires special safety. Whether you have, like say, just if you're taking x-rays, that's where we're going to have the most exposure. You have got to be in a separate room. If you're handling a baby, or for that matter, an animal, and you've got to be in the room, and you don't have them anesthetized or taped down some way, you're going to have to wear a lead apron, lead gloves, but don't put them under the radiation. You need a thyroid guard made out of lead. And you talk about heavy, but you've got to protect yourself from radiation. Noise. If you work in a place that has really loud noise, OSHA is going to require the company to give you earplugs. And they're also going to require the company to have your hearing checked and tested maybe once a year to see if they made you go deaf. And if they did, they're liable. So therefore, they're going to give you the earplugs, and they're going to make you wear them. Very important, though. My uncle worked for the railroad for 40 or 50 years, however long people work. Started when he was probably 16 and worked till he was too old to work. But he worked on the railroad, very, very nosy. This was pre-OSHA days. Deaf as a doorknob. He had a hearing aid that worked pretty well. And his wife just loved to just nag him and nag him and nag him. And you'd hear him, and you'd see him reach up there and turn that knob down. And then he'd just be just a fussing, and he'd just, yes dear, nodding his head. And they were both happy. Okay, thermal exposure. You got to be careful if you're exposed to heat. You have to have specialized clothing if you are exposed to heat. Laboratory safety equipment, fire extinguishers, hoods, autoclaves, eyewashes, showers, refrigerators, and correct disposal of hazardous waste. Okay, fire extinguishers are going to be marked: ordinary combustibles, flammable liquids, electric combustible metals. You need to know, even if you're not in charge, if you're just working or you're a student in a classroom, I just look around and see where the fire extinguisher is. It's not a bad idea just to know, just to be safe. And if you don't know where it is and you don't know what to use it on, then you haven't done anything. Fume hoods. I have an interesting story on general purpose fume hoods. These take things that aren't that hazardous and fume them to the outside world for everyone else to breathe. When I was in high school, we had someone put in the chemistry lab. It was downstairs, and they put in a vent for the hood, and they vented it into the classroom upstairs. Well, in lab, our teacher taught us how to make nitrous oxide laughing gas, and we were just in there all safe and working well, and then the teacher came running down from the upstairs classroom and said, "What are you doing? What are you doing?" And we explained. Anyway, we had to stop our experiment, and they got all those students out of the classroom upstairs. But we had given them all a serious buzz. But they had plenty of oxygen, so they weren't in danger of death. But I think we made them all high as a kite because someone did not know the general purpose hood cannot go into another part of a building. It has to go outdoors. Radioisotope hoods are going to have to be specialized and made that they can take care of radioactivity. Biosafety cabinets, if you have even a biosafety level 2 lab, you're going to have these cabinets that are going to capture and prevent microbes that are dangerous from going out into the world. Perchloric acid hoods, if you have a procedure you use perchloric acid, you've got to have one of these. Here's a shower. Here's an eyewash station. I had an interesting thing when I was in undergraduate school. When I took organic chemistry, we had a lot of really cool labs where we did a lot of really cool stuff. But the teacher rarely showed up. He was in his office next door. He said, "Show up, come see us, come get me if you need me." Well, one of the students had some acid, and some of the kids were roughhousing, just freshmen, well, just sophomore college kids, roughhousing, and knocked a bottle of acid on this guy's pants. Well, I'm afraid that I went to school in the late 70s, and a lot of the guys wore these synthetic nylon-y pants, and that acid just melted them. So they stuck them, we shoved him under the hood, under the shower, pulled the thing and soaked him down. He was screaming bloody murder. Well, the entire front of his clothing just melted. He was not wearing a lab coat, which he should have been. It was the rule. Rather than ask to borrow a lab coat, he just ran. His clothes had dissolved off of him. He just ran halfway across campus to his dorm room, and he didn't come out for 3 days. And I will never forget that. And I graduated a long time ago. Anyway, he was kind of a jerk, so it made it even more funny. But you don't want to wear clothes that dissolve easily if you're working around acids. Waste disposal. You have got to have, for biohazardous waste, you have got to put, say you got bloody cloths, they've got to go in a red bag to be handled by someone who handles red bags. Broken glass has got to go in a cardboard box that's labeled for glass. I don't know anybody who will take this type of container anymore, but this is for non-infective. It says non-infectious syringes. No. Metal sharps that are just pieces of screw or a nail maybe, but nobody is going to take this. They're not going to carry it off for you. You've got to put sharps, syringes, they've got to go in one of these. And safety says, OSHA says, and protocols everywhere say, don't recap your needle, because when you recap it, you may stab yourself. Just take that syringe and needle and put it in this little box here. When it's full, you seal it up and you get another one out. And if somebody thinks you're using too many of them, don't worry about it. Just use them on your shift and let them worry about it when they get in trouble. So you must put your sharps in a container just like this with a biohazard. Even if you didn't stick that needle into anybody, you just have a needle or a syringe. An empty syringe that had never had a needle on it could possibly go in trash, but they probably would not want to take it, so you might have to put it in at least a biohazard trash. The disposal people will not pick up stuff that's not properly labeled. Protective gear, gloves. Latex are the most common, but I've had several students that have latex allergies, so I never buy latex gloves. Respiratory protection depends on what you're working with. You may just need a simple mask, like if you're going to be around humans, which are all considered infectious until proven otherwise now. Lab coats, eye protection, it depends on what you're working with, but really probably be good to have eye protection. You could splash things into your eye. In healthcare facilities, now there's really important in healthcare facilities to follow the rules. Hospitals, clinics, dental offices, outpatient surgery centers, inpatient surgery centers, birthing centers, nursing homes. Got to know and how to take care of, and you have to have training every year on blood-borne pathogens, biological hazards, chemical and drug exposure, waste products. You will get training from your facility on these, and we have to take, it's the same exact test every single year, but it won't let you just go through the test. You got to have the little video go. Safety in healthcare facilities, just showing you a few of the things you could be exposed to. Hepatitis B can cause lifelong liver infections, liver cancer, liver failure, and death. This is a vaccine that, in my opinion, if you're working around humans, you must get. Now, see, this is hepatitis C. No symptoms until you start getting cirrhosis. They do use interferon on it, but now it says no cure, but there is treatment that is showing promise. Some people have been apparently cured of this without a liver transplant. HIV. Everyone is infected until proven otherwise when working around blood. The first thing you do when someone is bleeding is you put on gloves, assign someone else to dial 911. After you put on gloves, then you can take whatever you can, paper towels, cloths, to press on the bleeding to try to stop it while you wait for help. But as far as touching human blood, it's clean after it's sat in Clorox for a while. But even if they just got checked, you've got to be careful. Now, if you have a needle stick, you've just given someone a shot, and you don't know if they have AIDS or not, you need to ask their permission to get HIV test, for them to get one. If they refuse it, they cannot be forced to give you the blood sample, which is kind of bad. But the first thing you do if you are stuck with a needle is you wash that wound thoroughly. Let it bleed, wash it some more, wash it, bleed. Then you go immediately from there, and you put a Band-Aid on it after you're through letting it bleed as much as it will. Then after that, you go to wherever it is you go, depending on your facility. It may be human resources, it may be security, whatever, and you fill out an incidents report. we used to have to do it with security. I don't really know if that's still what happens. And that incident report must be done now. Now, if the person does have HIV, you can be put on drugs that will prevent you from getting AIDS, and then you won't have to worry about it. So it's just way better you report it now. Now, viral hemorrhagic fever, I think in your typical hospital environment, you're probably not going to get Ebola. But if you do, and there were some nurses that were exposed to Ebola in the United States when they brought some people over. There was a guy who came from Africa that had been exposed and didn't know it, and exposed quite a few people, but just a few people got it. And then you remember that big Ebola epidemic that they brought the doctor back, and one of my students was actually on the ambulance that transported him into Emory to be treated, and nobody there was exposed. Okay, physicians' offices, doctors' offices, clinics, documented management. They're going to have to provide blood-borne pathogen training. They're going to have training on how to handle medical devices safely, infection control, patient safety, facility and worker safety, security. When I worked at the last veterinary clinic I worked at, they said about security. If someone comes in with a firearm and says they want the money, give them the money. If they want drugs, give them the drugs. We'll call the police later. It's just it's not worth dying over. Regulatory and governmental agency requirements, and then record keeping and prescription medication safety. You have got to be sure that if you have an opiate injection and it is your standard of care at your facility, that if you're giving the injection and two people are supposed to sign off, be sure they both sign off that it was given, so you can't be falsely accused of stealing it. Hospital safety is very regulated. You have to have good hygiene, hazardous communication. You have to have a hazardous waste disposal plan. You pay a company to come in and pick stuff up. You need a disaster plan, risk management. OSHA regulations apply big time, and they will check you. Nursing homes and personal care facilities, highest rates of injury and illness among healthcare industries. I know back last year when everyone, 2020, in case I'm keeping this going a while, back in 2020 in Thomaston, 2 of the nursing homes had so many people getting COVID-19 that the National Guard came in and helped take care of things and retrained people and just helped clean the facility, and it's apparently calmed down. Okay, they have guidelines. The thing about nursing home personnel, you're picking up heavy people, and there are ergonomic guidelines that you really need to be sure. Don't be a hero. Don't pick somebody up by yourself. Do whatever it is you're supposed to do to take care of handling them so you don't get hurt. And you also want to be careful about transmission of diseases. Emergency response. If you're in a lab, you need to know the specific emergency procedures for your institutions. You have to follow OSHA regulations. You have to have a hazardous waste plan and an emergency response plan. And that's it for now. Thank you.